We know that many patients with anorexia nervosa exercise compulsively. In fact, Goel, who coined the term anorexia nervosa over 100 years ago, noticed this and in his writings wondered how patients who were so thin seemed to be able to do so much exercise. Overexercise is often one of the more difficult symptoms to treat in patients with anorexia nervosa. Some hospitals have developed exercise programs for such patients, trying to teach such patients how to exercise appropriately, that 3-4 hours a day of exercise is not appropriate. Exercising when one has a painful injury is not appropriate. We, in conjunction with Loughborough University, are developing a cognitive behavioural-based program for treating patients with overexercise in anorexia nervosa. This program, which is known as LEAP, the Loughborough Eating and Activities Program Therapy, will be available to clinicians in a few years' time. It's undergoing experimental research in both the United Kingdom and Australia, and the hope is that this treatment, which is cognitively based and developed both in the UK and Australia, will be able to help those patients who have an over-exercise problem in anorexia nervosa. Hi, I'm Professor Stephen Touyz. I'm Professor of Clinical Psychology at the University of Sydney and the Executive Chair of the Centre for Eating and Dieting Disorders. I hope that you found the information in this particular Q&A video helpful. Eating disorders are indeed a complicated subject matter, and many family members, patients, carers and others are often perplexed about the subject and sometimes overwhelmed as there's so much information to take in and so many questions to ask. To make these things a little easier for you, I have made 10 short Q&A videos just like the one you've just watched, where some of the answers to the most common questions people ask about eating disorders are made. These are answers that I've developed from over 30 years of clinical and research experience in this field. To watch these free videos now, please visit stephentouyz.com/free. Thank you.